All right. Well, welcome back, everyone. And for those of you who this is your first session, welcome. And thank you for joining us for the National Board of Public Health Examiners CPH Review Session Series. For those of you who don't know, my name is Ashley Mueller, and I'm the Manager of Educational Programs at NBPHE. And we are excited for you to be here for our third session. So I want to just go over a couple housekeeping things before we get started and I introduce our speaker. First of all, in the chat, I've posted some links. These are the links that I sent you yesterday in the email. And if you scroll all the way to the top, they're the very first thing posted in the chat. So the first link is for the previous session recordings. This link will be the same link for all of the sessions going forward. And it has the last two on there if you need to catch up. The second link is for our study resources page on nbphe.org. This is where you can find the materials to help prepare you for the CPH exam. It includes the free practice test and links to purchase the study guides. Then the last two links are the worksheets for today's session that Dr. Wright supplied for you. So just as in the last few sessions, I'll monitor the chat. And if you have any questions for our presenters, you can put those in the Q&A. And if you have any questions, again, we'll answer those at the end of the presentation. So once again, we have another raffle for the APHA CPH Review Exam Guide. Our winner from our second session was Aisha Turner. So congratulations, Aisha. And we will be raffling off another copy of the study guide today. So I will announce that in our next session. And if you win, you will be getting an email from me tomorrow. So let's move on then to today's topic. So our topic today is communications, presented by Dr. Patricia Wright. Dr. Wright is a professor of nursing at the University of Scranton in Scranton, Pennsylvania, where she teaches community health nursing, end-of-life care, and research. She is also an affiliated professor in the Department of Health Administration and Human Resources. Dr. Wright has practiced community-based nursing care as a registered nurse and later as a nurse practitioner, and has developed numerous community health wellness initiatives. So with that, I'll turn that over to Dr. Wright. And Dr. Wright, you can start your presentation.
Thank you so much, Ashley. I really appreciate it. And welcome to everyone. I'm so excited that there are so many people here today. Love spreading the message about public health and public health certification. So I look forward to this time that we have together. Let me just pull up my slides and we can get started. Okay, how does that look? Oh, wait a minute. Sorry.
It's a little delayed, but we're getting there.
Okay. Okay, can everybody see that now?
Yeah. There's a bar at the top. So
Oh, okay, let me see if I can get rid of that.
I think we're seeing the Zoom boxes.
Okay. How's that?
Now we see something in the middle.
Is that gone?
Yes.
Okay, perfect. All right. So, as you all know, today is the session on communications, which is actually one of my favorite topics. So I hope that you all like it as well. It is, as you know, part of the CPH exam. And so we'll go through each of the sections that have to do with communication. And then at the end, we'll do some practice questions as well. So as we think about communication, what is communication? Communication brings people together through a number of different formats. And specifically, some topics for the CPH exam that we'll be looking at are the ways that messages are used and communicated in the context of performing, preventing, and providing healthcare, and handling healthcare emergencies such as disasters. So some key terms that will help to frame what we'll talk about for communication are, what are messages? So what does the message consist of? The message is any piece of information that can be put into words, gestures, glances, or symbols. So the main idea of the definition of a message is that it doesn't always have to be verbal and it doesn't always have to be written. A lot of times in public health, we are communicating with written communication and handouts, or we are speaking, but it doesn't only have to include those forms of messaging. The medium is the way that the messages are communicated, or the conduit of the message. So this could include sounds, it could include printed materials, or it could include visual images. And we'll talk more about each of these media as we go through the presentation today. A channel is a way that we disseminate the message. And so this could be through speaking. It could be through radio messages. It could be in magazines. And as of 2024, much of our communication is through social media. But it can also be through other channels, such as warning labeling that you might see on packs of cigarettes or tobacco products or alcohol products as well. And sometimes when we are trying to communicate, there's interference that prevents that message from being communicated the way that we intend it to be communicated from ourselves to the receiver. That's one way that interference can occur. And the other is that anything that's on the receiver side that may interfere with their interpretation of our original message. So both of those are called noise in communication. So all of that information was to frame what we're going to talk about in terms of the domains of the Certified in Public Health exam. I'm sure that you've seen this before. These are all of the domains. There are 10 of them. I won't go through all of them, but I just wanted to give you a visual so that you could see that the communication piece on the exam has the same weight as all of the other pieces. Each section is worth 10% on the CPH exam. There is a lot of information in the section on communication. There are 20 tasks under the concept of communication on the CPH exam, but 20 tasks can be a little bit daunting to try to memorize and to sort out. So these 20 tasks have been grouped together into 6 clusters. And this clustering was done by Parvanta and colleagues in that 2018 book that Ashley was just holding up. If you don't already have that book, this is not a conflict of interest for me. I don't have any stake in the book. But if you don't already have it, I highly recommend it. It has a lot of really good information that is presented in a way that's pretty easily accessible. So that's where these clusters came from. This is how they're arranged in the book, and it is very helpful as you're preparing for the exam. So those 20 tasks have been clustered into 6 clusters. Cluster 1 includes everything that has to do with making health communication more effective. Cluster 2 includes health literacy and cultural tasks in health communication. Cluster 3 covers risk communication, and that's a pretty big cluster, so that's all that's in there. Cluster 4 covers non-urgent communication. Cluster 5 is professional communication. And cluster 6 is ethics in health communication. So in this presentation, I'll go through each cluster one by one so that we'll cover all of the information in a nice, concise, and organized way. So cluster 1, as I mentioned, involves making health communication more effective. If you were to look at the 20 tasks that are outlined for the CPH exam, The tasks that would be included in cluster 1 are 2, 3, 4, 6, 9, 16, 19, and 20. So cluster 1 covers a lot of territory in terms of the content on the certified in public health exam. So cluster 1, as I said, focuses on making health communication more effective. And the way that we do that is by using a social marketing approach. And what that means is that we use marketing concepts to design and implement programs to promote socially beneficial behavior change. So when you think about marketing, you think about reaching the consumer, grabbing their attention, bringing the message to them so that they can take it in. And that's what we're also going to use in public health. But we were not focusing on marketing or selling a particular item. We're trying to focus on what are the needs of the recipient in terms of health education and change in behaviors. Health communication itself, again, using that marketing approach, takes place in 4 stages. Stage 1, as you can see in the National Cancer Institute's Health Communication Process Wheel from 2004. I know it's a little dated, but it hasn't changed. And there are 4 components. The first one is planning and strategy development. And this involves identifying how communication can be used to address the health problem, determining who the target audience is, crafting communication strategies and objectives based on consumer research. So there's background information there to be gathered before we start communicating directly or spreading messages. Developing communication plans, including activities, brokering partnerships, and conducting baseline surveys so that we can determine what our outcome measures are going to be. That's all included in the planning and the strategy development. And probably some of you have worked through this process as you've developed public health education programs. Once the planning and strategy is developed, we move on to step 2, which is developing and pre-testing concepts, messages, and materials. Step 2 involves 2 items. In this stage, we'll develop the message and the concepts and explore them with the intended audience using qualitative research methods. So here we might be gaining feedback through focus groups, talking to individuals who we would be targeting with the message to sort of test this out and see how it goes. We're going to gain feedback that way through the intended audience, which helps us to reshape the message as needed so that we can enhance the effectiveness of the message that we're trying to communicate. Once we have sort of pilot tested and pre-tested our messaging and our materials, then we can implement the program, and that's stage 3. In stage 3, we will introduce the fully developed and vetted program so that the intended audience can participate, hear the message, and we will track the intended audience exposure and responses. We'll engage in program evaluation, and then based on that evaluation, we'll make adjustments to the program as needed. And that leads us right into the 4th step, which is assessing the effectiveness of the program and making refinements. So this process is iterative. We're starting out doing some research, planning and implementation, pilot testing the program, implementing the program, evaluating how it went, and making any changes that might make the program more effective in the future. As we continue to look at stage 1 of this cluster, oh, I'm sorry, I forgot that I had these on the slides. I was just saying them off the top of my head, but these are on the slides for you. So just as a review, you can see stage 1, we talked about developing the program. Stage 2, pilot testing the program. Stage 3, introducing the program, running the program, getting feedback, and 4, making refinements based on the feedback. In cluster 2, we are looking at health literacy and cultural tasks in health communication. Cluster 2 includes tasks 1, 5, and 7. So here what we're looking at is health literacy, which is the degree to which individuals can obtain, process, understand, and communicate about health-related information needed to make informed health decisions. And we know that health literacy is a growing topic in public health because poor health literacy is both a cause and a consequence of other health disparities. So when we look across all of the health disparities across populations, we can see that social determinants of health, such as access to education, can cause poorer health literacy, and then a consequence of poor health literacy is other health disparities, such as poor access, lack of personal agency, and lack of advocacy. So this particular cluster is also very important for us to focus on as well. In practice, whether that's in public health practice or in primary health, health literacy is not something that is routinely assessed, but it should be assessed if it's warranted. Some of the ways that we can assess health literacy are by using tools that are in the literature that have been tested and have some really good reliability and validity. So these are just 4 that are out there. The first is the Rapid Estimate of Adult Literacy in Medicine, also called the REALM tool. There's the Test of Functional Health Literacy in Adults, the Numeracy Understanding in Medicine Instrument, or the eHealth Literacy Scale, which is called eHeals. So again, if we're unsure about health literacy for an individual or within a population, there are tools out there that can help us sort of gauge where that level of health literacy is. The Agency for Healthcare Research and Quality, AHRQ, recommends that we use what's called a universal precaution approach. And that means that we verify understanding with every patient every time by way of a teach back. So that's a really important concept that isn't something that I think that we think about all the time, but that is something that we should be doing, that universal approach to ensuring health literacy. And I have a brief video here. I'm going to start it, but if you can't hear it, please let me know.
Attaining health literacy is an overarching goal of Healthy People 2030, a recognition that health literacy is key to achieving all of Healthy People 2030's objectives. Health literacy is about people being able to find, understand, and use health information and services. Health information is often difficult to understand. Our health system is complex. However, we can make it easier. Here are 5 things to know about health literacy. First, organizations and professionals can improve their health literacy by using proven strategies, like answering questions in simple, non-medical language and developing and testing written materials with the audience they want to reach. Second, universal health literacy approaches benefit everyone. Vulnerable people like older adults, people who have difficulty reading and using numbers, or people who are not fluent in English face the biggest challenges. But anyone can have trouble understanding health information. If we act as though anyone is at risk of misunderstanding information, everyone is better off. Third, providers can use health literacy strategies to encourage people to take part in decisions about testing, treatment, and procedures. This lets people make healthcare decisions that fit their values, goals, preferences, and circumstances. Fourth, clear communication between providers and patients improves health literacy, particularly if providers take the time to listen with respect and make information easy to understand. Checking to make sure patients understand the information is also important to ensure patients are informed. Fifth, Being health literate will help people make informed decisions and take actions to improve their health. Being health literate can help people achieve their goals, whether that is trying to manage a chronic condition, engage in a healthy lifestyle, or take precautions to avoid getting sick. To learn more about how you can improve health literacy, visit health.gov/health-literacy.
Okay, so thank you for indulging me in that 2-minute video clip. It is brief, but it gives us a lot of really good information about how to approach health literacy. One of the pieces that I'd like to really focus in on from that video is that health information is complex. Many of you have been working in public health and health fields for a very long time, and you understand health information very well. But many people in the general public don't have a good grasp on basic physiology or chemical reactions of medications or proper nutrition, etc. So getting that information across to individuals can be a very complex task that, again, as they mentioned in the video, we need to approach with respect as we assess each person's ability to take in the information. And that will then hopefully lead to improved health and wellness for all populations. Cluster 3 is risk communication. This cluster includes only one task from the outline, and that is task 8. And some key terms that are important in this cluster are hazard. And a hazard is any source of potential damage or harm. Exposure, which is an individual's contact with that hazard. Risk, which is the likelihood of harm from the exposure. Shared decision-making, which requires understanding of the risks and benefits of taking an action, or on the other hand, maybe not taking an action. So an individual who's going to participate in shared decision-making really has to have some sort of an understanding about the consequences of their decisions and actions. And decision aids, which are tools used to educate the target population about abstract and, again, highly complex health concepts. And the International Patient Decision Aid Standards Collaboration publishes review criteria for decision aids, and you don't need to be familiar with all of the pieces of the tool. It's just helpful to know that the Sunday criteria is out there, and I did include that in the handouts if you would like to see it. So again, these are key terms that you may or may not see on your exam. Some exam questions might simply ask a knowledge-based question, such as a hazard is, and give you a definition. It might give you a definition and ask you to identify the correct term, or it might ask something, more along the lines of application. How do you ensure shared decision-making, or how do you review decision aids? So these terms are really important. There's just no way for me to tell you exactly how they'll be tested on the exam. With that information as a baseline, though, we can start to talk about risk communication in terms of some challenging situations. So the first one that we'll talk about, which is really important, is disaster management. And the reason that disaster management is an important concept for the exam is that it is one of the most challenging forms of risk communication, because individuals are at a point in their lives where they are either at risk, in the middle of a crisis, or just recovering from a crisis. So you can see on the screen, and this is also in your handout so that you can have your own copy of it and get a better look at it. This is the CDC's Crisis and Emergency Communication Planning Cycle. So as you see here, there are 5 stages. There's pre-crisis, and this is when we as public health professionals would be prepared for any type of disaster that could happen in our area. Foster alliances, often with healthcare providers, professionals, other emergency personnel such as police, ambulance, fire, etc. Develop consensus recommendations from all stakeholders involved, and test messages. So this is where we would prepare and think about how could we get messages to individuals and what is the medium that we're going to use to get those out. The next step is called the initial step, and this is where the event has happened, the disaster event. We acknowledge the event with empathy, explain the event and inform the public about it in simple forms. Again, this is not the time to, use our fancy healthcare terms. We just want to have a very brief message that is concise and easy to understand. We need to establish an agency and a spokesperson who's going to be the touch point and bring credibility to the message. We'll provide emergency courses of actions that we will communicate to the public, including how and where to get updates and more information. And we'll commit to stakeholders and the public that we will continue to communicate with them as new information becomes available. The next phase is maintenance. And during this stage, we'll help the public more accurately understand its own risks. So what are the risks involved? And that again goes back to that decision-making. In shared decision-making, individuals and aggregates need to understand the risks of either taking action or not taking action. Provide background and encompassing information to anyone who needs it. Gain understanding and support for response and recovery plans, listen to stakeholder and audience feedback, and correct any misinformation that is out there, either within groups, within communities, or that's even coming from other channels that they may trust. Explain any emergency recommendations, so give some idea of why we're making these recommendations. And again, empower that risk-benefit decision-making. So repeating the message and explaining the consequences of action or inaction. The next stage is resolution. And so this is post-disaster. Improve appropriate public response for future similar emergency situations. Honestly and openly examine problems and mishaps, and then reinforce what worked in the recovery response and what could be changed. Try to involve the public in allocating resources for the problem should it occur again, and also in joining together to develop and maintain or modify those disaster plans as needed. And promote the activities and capabilities of agencies that were important during that disaster. So maybe one of the things that we would look back at and discover in an evaluation is, are certain agencies underfunded? Are there resources that, are now needed? And the last stage is evaluation. That's again part of looking at what worked, what didn't work, documenting the lessons learned and needs moving forward. So that's a really helpful guide to consider. How do we communicate with the public during disaster times? Also, during disasters, this is a really nice tool. It's called a message map, and it's used to determine how we're going to present information in short phrases of no more than 27 words. And again, this is where we go back to that media messaging. This should be like a sound bite. So this figure, this message map figure, is in your handout so that you can see an example of how you would use this. So at the top, right under where it says message map, you see who is the stakeholder. So what group are we trying to get a message to? In this example, it's the general public. And then our question or concern. I just made this up. How can caregivers for high-risk individuals protect themselves? So this is a message map for COVID-19. So we want to lay out no more than 3 key messages. And you can see under key message 1, this is the first message that we want to get out to the public. And an example would be social distancing is an effective way to prevent the spread of disease and protect yourself and others. So that should flow from the question or concern, which is how can caregivers of high-risk individuals protect themselves? And under every key message, you want to have at least 3 supporting facts. So that if, again, when the public says, how do you know this? I'm getting a different message, that you have some supporting evidence to uphold that key message. And again, you really don't want more than 3 key messages to be going out at the same time, because again, health information is complex. Health literacy is not high in the United States. So we would only go with 3 key messages, and we wouldn't give the supporting information all at once, just the key messages, but we have the supporting evidence there in case we need it to underpin our message to the public. So the message map is a really nice tool in helping us to plan communication of risk. And again, that should be no more than about 27 words per message. So nice, brief, and concise messaging for the public during time of crisis. When we are not in a time of crisis, we are using non-emergency communication. And this is what's included in cluster 4. So cluster 4 includes the tasks 10, 12, 13, and 20. And the kinds of information that we would include as non-emergency communication are health policies, implementation of new programs, any resources that are there for the public, any emerging health issues that maybe we're keeping an eye on, the role of public health, and the results of evaluations. So these may be important pieces of information, but they're not emergent. Non-emergency information should address these 4 key questions. So when we're getting a message out, this is what we should always include. What did you find? So describe why did it happen? So explain why this situation happened. What does it mean? So we will interpret what is happening and what needs to be done about it. So what action are we taking? So you can see that in non-emergency communication, we have a little more latitude in terms of giving a description and an explanation and interpretation of what is happening, as well as the actions that we're taking. We don't have to keep it now to 27 words using that mapping tool. We can really give a little more information because we have time to reiterate that message with the public as needed. One thing to keep in mind in non-emergency communication, and this is just general good information for all kinds of health communication. Some of you may have masters in public health, may have degrees in epidemiology or statistics, healthcare, so on. We love statistics when it comes to research, and many researchers and clinicians do rely on those numbers in terms of risk ratio, the percent of the population who'll be affected, et cetera. And we use those numbers to think about who's at risk and how we can prevent risk, and the percent by which risk can be diminished through interventions. So when we think about the use of statistics, we need to think to ourselves, okay, that's our information. That would be considered part of the support for our key messages. But it is best not to start throwing out statistics to the general public, because the general public lacks, in general, what is called health numeracy. And that is the ability to understand clinical and public health data. So again, health information can be very complex. Statistical information, such as risk ratio and so on, that's another level of complexity. So for the exam, just keep in mind that we don't generally give statistics as part of health information unless it's something that you could sort of see in the air, like, the equivalent of some disease is a plane falling out of the sky every day, or 1 in 4 people has a certain illness, something that's sort of easy to grasp, but we're not going to use very complex statistics or numbers because of the limited health numeracy that most of the general public has. We can save those statistics for when we're communicating with other professionals, and professional communication is in cluster 5, which includes tasks 14, 15, 17, 18, and 19. And cluster 5, or professional communication, refers to the sharing of information between and among colleagues. So in this cluster, this is where we would be able to really use all of that research information, the statistics, talking to different agencies. We're all speaking the same language. And usually our communication is related to health disparities, lessons learned from health promotion programs that we have implemented, or disaster programs that we have implemented. Population needs assessments, we share that information, healthcare, and/or we might be seeking resources through proposals or seeking to partner with other individuals, agencies, or healthcare systems as well. So there are some models published on how we can shape professional communications. Again, like the literacy tools, you don't need to know all the ins and outs of these agencies. They just have models developed and published on how professional communication can take place. So 4 of these professional organizations are the Association of State and Territorial Health Officials, the National Association of City and County Health Officials, the American Public Health Association, and the Association of Schools and Programs of Public Health. And organizations and agencies that serve as conduits for public health information include Health Resources and Service Administration, or HRSA, the Surgeon General's Report, or Morbidity and Mortality Weekly Report, MMWR. So what is meant by this is that much of the public health information that we can gain information from is filtered through these 3 organizations. There are others as well, largely government organizations, but this is where we would go to find information, again, not necessarily accessible to the general public, but they're conduits for professionals like us that we can find statistical information or evaluate needs within the community or even across the country. If you're not already signed up for the Morbidity and Mortality Weekly Report, I definitely recommend that. There's a lot of really good information there for you to access that may help you as you're planning health interventions. Cluster 6, we're coming to the close now. This is the last cluster, includes ethics in health communication, and this is only 1 task. And so in this cluster, we are looking specifically at ethical principles that we need to apply when we are communicating with aggregates or communities. So any information that we share must be accurate, and that is related to the ethical principle of veracity, which is truth-telling. We need to disseminate the information to all intended audiences, and that is related to the ethical principle of justice, which is fairness. So what that means is that we're not going to share health communication with only certain groups or certain parts of the community. We're going to ensure that it is disseminated to all intended audiences. And we also must ensure that the words and images that we use in our communications are acceptable to all groups. We do this through that first step of the health information wheel that we talked about, where we are pre-planning our programs. In this stage, we will talk with stakeholders. We'll start to develop materials, and then in that second step, we would be pre-testing them. So that's how we can ensure that the information that we are sharing is accessible and that there are no images or words that are offensive. So I'll give you a brief example. I have a colleague who runs perinatal loss programs. And so she works with bereaved parents who have experienced pregnancy losses and neonatal losses. And so she wanted to have a memorial garden in the community, so someplace where they could have remembrance services and so on. And as a marker in that area, she wanted to have a statue of an angel, which seemed like a good idea, but she wanted to make sure that all of the people who would go there would be okay with the image of an angel. So she went around to various faith communities. She did surveys of the people who came to her support group, and she found that all of the people who participated in her groups and in speaking with various religious groups, no one had any issue with angels. So that's what is in the garden right now, is a statue of an angel. But even though this may seem like a benign example, you just want to be sure that in your effort to help individuals that you're not inadvertently being offensive in any way. So that is the end of our 6 tasks. And I know that that was a lot of content. So I'm going to, before we move on, I'll just give you this little quote. Communication, the human connection, is the key to personal and career success. So before we move on to the practice questions, I'm going to stop sharing. And I'm going to ask if anyone has any questions that they would like to. I know that Ashley is monitoring the chat. If there's anything that anyone wants to ask before we move on to the questions. Oh, I'm seeing some of your questions now, social, or some of your comments. I couldn't see them as I was talking. I like social math too. The real Dr. Fauci.
Yeah, so if anyone has any questions, please put that in the Q&A so we can ask those. If not, then we're going to move to the practice questions. But I see someone already sent in a question. It says, how can we evaluate the health literacy level of a document?
Oh, thank you for that question. I'm sorry, I thought that I had that in there. I do have it in my notes. I apologize for that. Let me just find. Here it is. Okay, I'm sorry. I thought I had that in one of the slides. So the way that we're going to assess any health materials that we're going to use, there are a couple of indexes out there that help us determine the readability. So the CDC actually has a clear communication index tool. That tool is very effective, but it's the most complex one to use. It's the most sophisticated tool. So 2 others that are very easy to use and that everyone has access to on your computer in Word. The first one is the Fleisch-Kincaid scale, and that will give you a grade readability level for all of your documents. So you can open the document and go into tools, and the Fleisch-Kincaid level assessment is there. Most resources recommend that you don't want to go any higher than a 7th grade level for readability when you're developing documents. And so the Fleisch-Kincaid level will give you that grade level. So if it's above 7th grade, it will actually even give you suggestions on how to modify those materials. Another tool that's available in MS Word, Microsoft Word, is the simple measure of gobbledygook, and that's called the SMOG tool. And that's also another really easy tool to use that everyone has access to. So I'm sorry, I did mean to say that, but I'm glad that you brought that up.
Okay, so our next question, I'm going to go over here in the chat. With so many organizations and agencies mentioned, how well in depth should we know them and their missions, or do we need to generally understand what they offer?
Yeah, that's a great question. you're not going to have any questions on the exam that say, please tell me the mission of this organization. It's not that in depth. Those examples are only given as that. They're given as examples. So if there were any questions, it might be something like, where would be a good place for a public health professional to find statistics on morbidity and mortality? And you might be given some options. So I would just only know, what you can get from those resources, but you don't have to get very deep into that. I hope that that helps. But if you need more information, I'm happy to talk about that more.
All right. So the next question is, so if one person in the group has actually been sensitive to using the angel, would that have been sufficient reason to exclude the angel idea? For example, is there a mathematical model to assess if something is appropriate regarding terminology?
I love the statisticians. I think that that is going to be part of your professional judgment. I would not have used it if even one person were offended, but there, as far as I know, there's no statistical model, for determining what's the threshold for someone to be offended. It's a matter of, how offensive you think it might be. Will people still use, like in that example with the angels, would people still use the garden? You're developing educational tools for individuals that you want them to use. So if one person is offended, it's likely that others would be as well. So that's, again, a piece of your professional judgment. Someone trained as an econometrician. Yeah, exactly. So yeah, for sure. But as far as I know, there's not a statistical way to figure that out. So that's part of your professional judgment as well.
Okay, so this one, what are the tasks and why are they so specific to each cluster? Is it part of the exam outline? So first of all, yes, it is part of the exam outline.
Yes. Yeah. So we'll start there.
Yeah.
For sure. If you go to the exam outline, it will have all 20 tasks there that are under the topic of communication. And as I mentioned, it's kind of hard to really think through 20 tasks. So that was the way that they were clustered in the exam review book. You don't have to memorize. There's not going to be a question that's like, which of the following is not a task of communication? But you do have to know generally what the tasks involve. And so clustering them in this way gives you a pretty nice way of pulling that information together pretty tightly. So you don't have to have the clusters memorized, just know the content that's there for the exam.
Okay, then how do we evaluate visuals in regard to health literacy, such as a diagram about how to use a medical device? How do we know if it's accessible to someone with low health literacy?
That's a great question. So the first thing that I would do is run it through either the Fleisch-Kincaid scale or the SMOG scale in MS Word to give you the reading level of it. So even in diagrams or other health infographics, it will still give you the readability level and what grade level. In terms of things like color, like the color of the infographic and the way that it flows, that's when you can use that Sunday criteria checklist. That checklist actually was developed for research studies where patient information tools were developed, but the middle part of the Sunday checklist has some really good evaluation criteria for the tool. So that's a really good place to, use those criteria to see if the tool is accessible or not. And you can pilot test it as well. If you're developing it, you can use that cycle. And I would definitely pilot test it in stage 2 to see how it plays out with actual individuals and communities.
In these surveys, what is a good sample size?
Oh, that's a great question. So, so that is a really great question. We could have a whole course on how to determine your sample size. So if you're sending out a survey to gather information in a community, an informal survey, a good response rate is about 30%, right? So if you send out 100 surveys and you get 30 to 40 back, that's pretty great. Um, is that what you were asking?
Yeah, I was asking
Yeah.
about sample
Okay.
size. Yeah.
Yeah. So if you get 30% of the surveys back that you send out, that's a pretty good response rate. If you're asking, like, I want to know something about a community, so how much of the community do I have to include? That's a whole statistical test. You can do power analysis and so on, but you don't need to know that for the exam. They're not going to ask you how to calculate sample size for a research study. I don't remember that anyway. Maybe Ashley knows better, but
No. Okay, so then the next one is, could you address how accessibility, WAG, compliance needs, such as adding directions for screen readers or alt tags, fit into the idea of short messages and need for simplicity?
Can you say that first part again?
Yeah, it says, could you address how accessibility, and then it's WAG, compliance needs?
Oh, okay.
Yeah.
Okay. So you're talking about on-screen instructions.
I believe so. Yeah, it says.
Okay. So yeah, that's a really great question. So that really pertains more to like websites or on-screen information. So sometimes if you're trying to get a message out electronically, you're going to want to work with someone who has the ability to create websites. If you're doing it yourself through a Google site or something like that, you'll want to build in on the website a way for the font to be easily changed, a way for the brightness to be easily changed. And again, as you're developing content, you'll want to run it through the Fleisch-Kincaid or the SMOG tools so that you can make sure that your message is at the right level. Now, if you're developing information for healthcare professionals, of course, it's going to be at a higher level. But if it's for the general public, then we, want to make sure that it's not higher than the 7th grade level. And I would definitely partner with professionals who can help you to develop those electronic messages to meet the requirements for electronic tools.
Okay, it looks, we have one more question. DEI inclusion and primary colors are they best for visual graphics?
That's a great question. So typically, yes. As you're developing, handouts or anything online, primary colors kind of draw people's attention. So the DEI, could you say that first part again?
Yeah, just let me look. Sorry.
That's okay. That's
It's a
all right. I know
DEI
it's hard to answer them on this.
inclusion. Yeah, DEI inclusion and primary colors are they best for visual graphics?
Yeah. So primary colors, are, again, they draw people's attention. I don't know that I would mix them all up. I would, probably stick with one, and also keep in mind that if things are reproduced, they're most likely going to be reproduced in black and white. So when you're developing handouts, it's always better, especially if they're going to be reproduced, to, like, if you're going to develop something with a flow chart, the squares in the flow chart should be blank with just, black words in them, so that when they're reproduced, you can see the words, as opposed to having the blocks filled with color with white words, because then when they're reproduced, they're going to be harder to read. So the easiest thing to read is plain white background with black text. So if you're going to use color, yeah, I would go with, primary colors, just to emphasize things that you really need to have emphasized.
Okay. Then we have a question about AI. So quick
Okay.
question about AI generated communications. How is AI changing the communications field?
Oh, that's a great question. So I'm going to assume that you mean like ChatGPT or some of the chat bots, like you get on a website and it's like, how can I help you today? So as far as health information, I think the effect of something like ChatGPT is going to be similar to the use of Google. like when individuals come in asking questions because they've read something online, ChatGPT will give them more information, and other AI assisted searches will give them more information that they can delve into. So they'll come to us sometimes with more and accurate information, and sometimes with more but less accurate information. So it's also up to us in that stage 1 planning to go out and see, you know, what's out there for the general public and what might be some misperceptions that individuals have. So that's, you know, the consumer side. From the professional side, as far as our use of ChatGPT and other tools, this is still developing. So there are 2 schools of thought on this. The first school of thought is that we don't use it and that we create our own information, and that's research based, and develop our own tools. And the second school of thought is that this is technology that is not going away. So we should learn how to use it and master it and correct any imperfections that occur when we use it. So there aren't really guidelines there yet in terms of communicating with the public or correcting public misperceptions related to AI, because it's still developing. So that's not something that will be on the CPH exam yet. But as far as our professional obligations and our ethical obligations, that's where the 2 schools of thought are at this time.
Okay. There's a question about the tools and links to these tools. So the Flesch Kincaid and I don't know if it's SMOG or
The SMOG, yeah, the SMOG tool.
SMOG. Do you have any suggestions of where to find those?
Yeah, just give me 1 second and I can put a link. Hold on 1 second.
Let me scroll.
Here, this is just from Microsoft support. I'll pop it in chat. Yeah, that's exactly what I did. I Googled it. Thank you, Amy. That's the Flesch Kincaid. And let me go to SMOG. And you know what? Thank you for asking that, because next time I can put the links on the handout.
And there is one more question about
Yeah, sure.
the reading level. Someone says that we're always taught no higher than a 5th grade level. Is this still accurate, or when did it change?
Yeah, so thank you. I usually go by the 5th grade level too, but for the exam, the review book says the 7th grade level. So that's why I use the 7th grade level in the presentation.
Okay. All right. It looks like we are out of questions for now. You ready for the practice questions?
Okay, yeah, absolutely. We'll move on to the practice questions. And so what I'll do is I'll pop the question up. And Ashley, if I remember, you said you'll just like look at the chat and see kind of what the consensus is, right?
Yeah, I have a poll, so I'll open the
Oh,
poll,
good.
but it would be great if you can display them so the
Yeah.
recording shows the questions.
Of course, absolutely. Let me just pop those up.
All right, and while she's doing that, I will get question number 1.
Okay, and let me hide my. There we go. Okay, so question 1, a
Oh, we're
team.
still seeing some of the holes, or the box in the middle right now.
Okay, I think that will fade.
Okay.
Yeah, I think it's gone now. Is it gone on your side?
Not yet.
I don't see it on my side, but I don't see the poll now
Okay,
either.
it looks like, yeah, it's okay now.
Okay. I don't see the poll, but that's okay. Maybe that's what was causing the shadow on my side. So
Yep.
that's okay. So if you could just tell me what the poll results are, then that would be great.
Yeah. Okay, everyone, I'm gonna close the poll now. So we have question 1, we have 73 said A, and then we have 2 for B, and then 25% that said D.
Okay. So Most of you got it correct. A team determines that photos of lungs damaged by cigarette smoking should be printed on packs of cigarettes. The primary audience for this intervention is current smokers. And so the rationale for that is that the primary audience is the group who should take action after receiving the message. So that's the definition of the primary audience. And so that would be current smokers. And the idea would be that if they could visualize what the damage could be to their lungs, then they would take the step of quitting smoking. Okay, and then I'll go on to question 2.
Okay, so I'll launch the poll.
Okay, so question 2 is using universal precautions when developing public health teaching materials involves A, wearing appropriate PPE when presenting the material, B, verifying understanding of the material, C, providing detailed statistical data, and D, writing the materials at a second grade level.
Right, so we'll give everyone 10 more seconds. See, we have about half the responses.
Mhm.
Okay, so here is the results. Looks
Okay,
like 72% said B.
okay, the answer is B. The universal precaution approach when developing public health teaching materials is related to verifying understanding of the material, and that comes from AHRQ. And this approach means that we verify the understanding with every patient every time by way of a teach back. Okay, and the next question.
Okay, so this one is a tool used to determine the reading level of printed materials is A, clear communication readability tool, B, grade level overview of words, C, the West Miller reading assessment, or D, the Flesch-Kincaid grade level readability tool. All right. All right, there's our poll results. We have 15% said A, 5% said B,
Okay.
percent C, and then D, 79%.
Good. Okay, so almost 80% got that correct. It is the Fleisch-Kincaid grade level readability tool, and that's available in Microsoft Word. And it rates the text of the document on a US grade test level. And just so that you know, those other 3 are just made up. So you will not see those on the test. So don't let those confuse you. The answer is D. I thought I did a pretty good job of coming up with those, though. Okay, we'll move on to question 4. The 4 Ps of social marketing, and remember we use that social marketing approach, are A, price, place, product, promotion, B, price, person, purpose, product, C, population, place, presence, promotion, or D, presence, practice, person, predict.
All right.
Okay, so the correct answer is A. The 4 Ps of social marketing that we'll include in our approach are price, the cost in terms of time, money, or other consumer value, the place, which is the location, the product, that could be the good that you're selling or the behavior that we're hoping to promote. And promotion is an advertising strategy or a campaign to raise awareness and or the action. Okay, and then the next question is question 5.
Minutes. For 5 more seconds. I'm sorry.
Okay, take your time. No worries, no worries.
All right.
Oh, wonderful. Yes, every single person got that one right.
Mhm.
That's good. So good. We don't have to go through that one. You did great. Okay, question 6. Anything that interferes with the receiver's ability to take in the message as transmitted is called A, interference, B, static, C, noise, or D, clamor.
Really?
Okay, the correct answer, which the majority of you got, is C. Interference, called noise, can be anything that prevents the receiver from decoding the intent of the original message. Okay, and we'll move on to question 7. An appropriately tailored intervention message most importantly should A, take into account characteristics of the target population, B, be designed through community organizational strategies, C, meet the criteria established by the funding agency, or D, be designed and tested by colleagues and experts in the field. Okay, yeah, it's A. In phase 1 of the National Cancer Institute's Health Communication Wheel, planning and strategy development, the primary, secondary, and tertiary audiences should be identified. The intervention should be based on evidence and accessible to the audience. The target audience should be engaged to establish mutual understanding of the message prior to its launch. Okay, so let's move on to question 8.
Sorry about that. Here,
That's
let me
okay,
launch it
no
again.
worries.
Does everyone see it?
I see the poll for number 7, the results.
Okay, let me just go back here one more time.
Okay, no
It's not giving
problem.
me the launch button.
Oh, that's okay.
Okay, let me get out of this and do this again. Well, it's not letting me launch this one. So if everyone could put their answers in the
chat, sure.
then yeah.
Okay, so question 8, when communicating to the public about a public health disaster, risk is described as A, the source of the disaster, B, the likelihood of harm, C, how one might come into contact with the agent, D, how to prepare for the disaster.
And then everyone's just seeing the black box over here, your screen.
Oh, sorry.
Yeah.
Okay, is that gone?
Yeah.
Okay.
It looks like I can't get the next one to launch either, so everyone could just put in chat. We've got lots of B's coming in for this one.
Good. Okay, good. So the answer is B. That is the risk of the likelihood of harm. The source of the disaster is the hazard. The contact with the agent is the exposure, and the preparation is disaster preparedness, which is D. Okay, so let's go to question 9. A health education program on viral transmission is evaluated as poor by the participants. The presenter should consider A, discontinuing the program, B, using a standardized criteria to evaluate the decision aids. C, adding morbidity statistics to address health numeracy. D, asking participants to complete a message map.
Okay, yeah, and everyone just please put it in the chat. So I just can't get the polls to launch right now, these last couple of questions. So we have a lot of B, we've got some D. Let's B.
Okay, so the correct answer is B. The tool is used to prevent information in short phrases. And you want to evaluate, to evaluate the decision aids. Did you say also D?
Yeah,
D
D was
is completed by us as the professional to develop the message that we're going to share with the public. So the participants wouldn't complete that. We would do that to plan our message. Okay. And our last question is 10. Planning a health screening event within walking distance to the target population is an application of this ethical principle. A, veracity, B, informed consent, C, justice, or D, non-maleficence.
We're getting a lot of C, a couple A's.
Okay.
Yeah, C and A.
Okay. So the correct answer is C, which is justice. And that means that everyone should be treated equally and have equal access to the information. A is veracity or truth telling, which is also very important. But since the STEM is asking specifically about planning the intervention within walking distance to the target population, that specific piece of the planning is intended to help increase access to the event. So that is justice. Okay, and that is the end. I wish you all the very best of luck on your CPH exam. And I hope that you all pass the first time. That's what we want.
Yes. All right.
Yes,
And thank you to
absolutely.
you, Dr. Wright, for being here today. We really appreciate you taking the time to go over this section. And then I hope
course.
everyone will join us next week for, we have Tuesday and Thursday. Tuesday will be the health equity and social justice. So I look forward to seeing everyone on Tuesday, and you can expect that the recording for today will be uploaded by tomorrow afternoon. All right. Thank you, everyone.
Thank you very much. It was great to spend the time with you. Good luck on the exam. Bye-bye.
Bye-bye.